From the most trusted names in local news, KDPG Sunday Edition.
And good morning and welcome to the KDPG Sunday Edition. I'm Paul Martino. Over the past 2 days, more than 1,300 volunteers came together with one goal: to provide free dental care to people who can't afford it. And they stand in line for hours just to see a dentist. The Mission of Mercy Clinic demonstrates just how great the need is. But that need for dental care and the money to pay for it, it's often not talked about. Why? Why is dental insurance given the short shrift when it comes to health care coverage? Well, our guest this morning might help us with that. We are joined by a man who knows quite a bit about dentistry. He is the Dean of the School of Dental Medicine at the University of Pittsburgh, Dr. Bernard Costello. We're also joined by Joe Smito, editorial writer for the Pittsburgh Post-Gazette. Good morning to you, gentlemen. Thanks for coming in.
Morning.
You know, we often hear cruel things said about people who have missing teeth. But if you ever lost a tooth and you found out how much it cost to get it fixed, it's not so funny, is it?
No, it's not. It's a complex set of needs. And you're right, dental insurance often has a hard time covering everything that we need it to cover, particularly for folks that are in need and don't have a lot of resources, particularly for those folks in our community that may not have employment, and that's difficult.
Yeah, and we were talking earlier that a lot of emphasis is put on our medical insurance, but dental insurance not so much. Why is that?
Well, it's really an illogical divide that has existed for almost 2 centuries from the beginning of our professions. There are dental professionals and medical professionals, and even though we work together all the time, I work at Children's Hospital and Presbyterian at UPMC and various arenas, the insurance products are separate and have been because the professions have been a bit separate since their beginnings in the 1800s.
The people who will stand in line and receive care at the Mission of Mercy Clinic, are they people who don't have insurance, or are they people who do have insurance but not to the level that they can afford to use? I mean, why are they there?
So most of the individuals down at the event are individuals that don't have resources and don't have a dental benefit. Or they have maybe complex problems that they're hoping that we, the School of Dental Medicine at the University of Pittsburgh and UPMC, can help with. And maybe they need some specialized care that they would have a hard time getting in the community.
So, I mean, if you don't take care of your teeth, it leads to other health problems, heart disease and so forth. So given that, why doesn't the country pay more attention to dental care and provide greater amounts of dental insurance?
It's a great question. There was just an article published in The Lancet, Europe's major medical journal, outlining a world health problem in this area and making the case that this is a very important part of overall health. It's directly related to preterm birth and cardiac problems, cancer, a number of other areas. And the world, not just the United States, certainly not just Pittsburgh, has a hard time providing the dental care that's needed. It's expensive, and just like much of the rest of healthcare, it's a challenge to provide all of it that everybody needs.
And the elderly are more likely than not to not get dental care, right?
That's right. And often when you have employment, you might have a dental benefit. It's usually fairly limited, especially if you have complex needs. And as we age, teeth become more complicated, and craniofacial and oral health problems become more complicated with cancer and the effects of chemotherapy. It's not just cavities and gum disease. Lots of things. Not
covered by Medicare.
No, not at all. It'd be like calling your homeowner's insurance and asking them to fix your car. They just don't do that. That's not their coverage. So.
Solutions? I mean, is there a way to make dental care less expensive? Is there a way to provide more care for folks like you're doing this weekend?
Sure. So this weekend is a start, and it's an important start. We have scores of individuals waiting in line at these events, but it's really just scratching the surface. The School of Dental Medicine at the university provides care at a much reduced fee compared to private practice environments, and we take just about every insurance that exists for those types of things. That's our mission. That's what we do. But it's not even close to fixing the real problem, which is a higher level of coverage from the federal government or other entities to try to take care of these folks.
Well, one of the dentists who took part in this clinic last year said that he received more hugs and thank yous from patients during that 2-day period than he had in 38 years of practice. Does that surprise you?
Not at all. you know, it's the reason most of us get into healthcare in the first place, is to help people. And the challenges of providing the care that we want to folks because of the expense are real. And to have people be appreciative like that is a wonderful thing. We have folks from the community, and 4/5 of our faculty are down here at these events providing care for exactly that reason. It feels good to do that, and we love to do that.
How much care can you provide in that clinic? I mean, often you need follow-up with your dental work, right? It's not a one-time visit.
You could think of this as relatively rudimentary care, like you would think of primary care or simple procedures done in an outpatient setting in medicine. So very complicated care that requires you to go to sleep, or specialized surgery, we of course can provide in this type of a setting, but it's a start, and it's a way to get folks into the system if they don't know where to go or how to do that.
Well, the number of people who turn up for care, who show up for care, is amazing. So is sort of the group of volunteers. They're not just dentists.
We have all sorts of folks. We have staff members from the School of Dental Medicine that are not in clinical areas, that are in research areas, just helping with the process, getting patients from here to there, checking them in, making sure they have a drink of water because it's been a long day, all sorts of things. And I have surgical technologists from Children's Hospital that help me in the operating room with procedures that are here as part of this process, volunteering with non-surgical procedures, just with the process. People love to do this. It's a great event.
As we have this debate over healthcare in this country, should this be a principal part of it? Obviously so, huh?
Without a doubt. So I referenced the Lancet article in particular because it's a meaningful, important medical journal. But the Surgeon General of the United States has commissioned a group of which one of our key faculty members is a part of to study exactly that. That hasn't been done in quite some time. And recasting that discussion, making sure that that's a priority. It's a priority for the Surgeon General. It has to be a priority for the country. It's an enormous expense to not take care of things, end up in emergency care at UPMC in our ICUs when it reaches the end stages. It's an infinitely more expensive prospect, and it's literally life-threatening. Surprising to folks that that's the case.
So people go to emergency rooms with their
all the time,
abscesses or whatever it might be?
All the time, and it's not the setting to do that, and it's usually the end stage. Some of them get quite sick. You can even die. There was a famous case of a little boy in the Washington, D.C. area a couple years ago. Just lack of dental care. Shocking. Absolutely shocking.
But not only do you end up at the emergency room for an abscess, but again, because dental, when you don't take care of your teeth, it leads to other health problems. If you're getting heart disease or diabetes or something, the costs, you know, are that much greater and have to be factored into any discussion you have about how widely available is dental care.
Well, and there's a real value in what's going on in Pittsburgh there. With UPMC Health Insurance and the dental product that they have the ability, and they're working with us, to start to think about how we provide more efficient care that gets it on the front end, that really does the preventive services that are needed. Most of dentistry in this country for the last century has been geared towards doing procedures and fixing problems. We'd like to prevent them ahead of time. Much better to do that, just like you hear in every other arena.
Well, I mean, holistic medicine is sort of the watchword today, so why can't or why shouldn't dental care be part of that?
Oh, that's right. It's hands down the most prevalent disease on the planet. It's not even a contest. Caries, what people call cavities.
Is this an even more difficult problem in rural areas? Here in Pittsburgh, we have plenty of dentists and facilities.
It's not a discriminator that way, but getting care in rural areas is, and getting preventive care is a problem, so it tends to accelerate. And it particularly accelerates in times of economic downturn. So if a particular area is having trouble, and we have that in Appalachia here, that's something that we study with our group of researchers. It is an issue, and trying to get that care to those individuals is even harder. It's hard to drive 3 hours to come to this event on the weekend, or even to come to the School of Dental Medicine.
Yeah, I mean, you know, you mentioned rural areas, but I mean, these clinics, run by various people, are held all over the country, aren't they? And they're similarly popular.
Right. There's not nearly enough of them. We could hold one of these every weekend and still not get to it all. Mike Zamias, who's the CEO of Teletracking and really the force behind this mission with a small group of other individuals organizing it, is that story. Came from Johnstown, came from modest means, and remembered it. And this is why he's passionate about this and set up the Mission of Mercy in the first place.
Do you have any advice about getting dental insurance? Is there an inexpensive route? Any plans we should look at?
Yeah, I think you could think of it much like your other benefits that you see, whether it's health insurance or otherwise. There are basic plans that one can acquire through many different companies. Most people get that through their employment. Although unfortunately they tend to have higher deductibles and low maximums. So if you need complex care, it's helpful to have a place like the School of Dental Medicine that does it at a little bit of a reduced fee compared to the community, particularly if you have very specialized problems that are very complex. We have some of the best faculty in the world for these types of problems at our place.
What about veterans?
Sure. Veterans often get some benefit through their service connection. There is an operation that we're associated with at the Veterans Administration Hospital, mostly the one in Aspinwall. And they have a nice operation there that's quite good. Depending upon your involvement with the military and your service connection, that benefit varies. So if they don't have much benefits, often they come down to us and we can help with that.
We thank you for your great efforts. I know we cover the clinic every year, and it is always packed. It's very, very popular. Wish we could do more.
Yeah, it's my pleasure to be with you today.
All right. Thank you, Dr. Costello. Coming up, we go beyond the bike lanes. We'll look at the present and the future of biking in the city of Pittsburgh when the KDPG Sunday Edition returns.